Good afternoon, Matthew. Thank you for being here at the second Digital Health and Wellbeing Conference. You've just given a fantastic presentation on the use of digital technologies in primary healthcare and how primary healthcare is evolving within the NHS and in GP surgeries. Just have a couple of questions for you. The first, as a GP in West Yorkshire, you work and treat the community on a daily basis. From the standpoint of digital health and well-being, what would you say has been a turning point in your career and treatment of patients?
I think the single biggest change in my career has been how we can now support patients with cardiovascular disease, particularly issues around heart rhythm issues and issues around blood pressure, because that used to require either devices which were tied to your chest or regular attendance in general practice for blood pressure monitoring, and we can now send that technology out with you and receive the information remotely. I think that's cutting the umbilical cord to the doctor and giving the patient a lot more self-control.
Great. Can you describe how digital technologies can impact the lives of your patients and society, but also how technology can assist the medical profession?
It's always nice when we're talking about health technologies to think of individual patients, and I can bring a patient to mind who suffered a severe stroke only at the age of 37, which of course left him initially quite incapacitated. One of the problems was that if we dropped his blood pressure to the targets wanted in that setting, he'd become very symptomatic with dizziness due to the narrowness of one of the arteries in his head. Using modern technology, we allowed him to leave the practice with his own blood pressure monitor that I could monitor remotely, so we could find that absolute pinch point between blood pressure management and his symptoms, and it allowed us to modify his medication almost on a daily basis to free him from symptoms, but also to free him from the practice. I think being able to liberate people away from general practice reinforces the message that part of healthcare is always how you look after yourself. And apps that allowed you to monitor yourself in the community, but communicate the important information with me as a general practitioner, are going to be a very liberating way to move into a new era of the NHS, where the patient and doctor are in partnership, not in a child and parental role.
Great, thank you. And my final question is, if you had one wish, what would you like to see happen in the future relating to digital health and wellbeing?
I think one of the big issues that we have in digital health at the moment is the fact that it's being developed invariably by smaller companies that struggle to get the evidence base that we would want as clinicians. And I think that what I'd like to see in the future is the NHS invest much more in developing technologies to ensure that these are researched properly, so we have a solid evidence-based footing to recommend their use with our patients.
That's great, thank you very much.